Nurse Aide Exam Questions and Answers PDF. Question 1. When a client expresses a spiritual or religious concern, the nurse aide should: Option A. Offer to contact the hospital chaplain or the client's clergy. Option B. Provide personal spiritual advice. Option C. Tell the client to pray about it. Option D. Change the subject. The correct answer is option A. Offer to contact the hospital chaplain or the client's clergy. The nurse aide should support the client's spiritual needs by offering to contact a chaplain or clergy. Personal spiritual advice is outside the scope of practice. Dismissing spiritual concerns ignores holistic care. Question 2. When providing oral care to an unconscious client, the nurse aide should: Option A. Brush the teeth vigorously. Option B. Use a sponge-tipped swab moistened with mouthwash. Option C. Place the client on their side and swab gently. Option D. Skip oral care for unconscious clients. The correct answer is option C. Place the client on their side and swab gently. Unconscious clients should be positioned on their side to allow fluids to drain, preventing aspiration. Gentle swabbing with a sponge-tipped applicator should be used. Oral care should never be skipped, it prevents pneumonia and infection. Question 3. A client at risk for pressure ulcers should be repositioned how often? Option A. Every hour. Option B. Every 2 hours. Option C. Every 4 hours. Option D. Once a shift. The correct answer is option B. Every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 4. The pulse deficit refers to the difference between: Option A. Apical and radial pulses. Option B. Systolic and diastolic pressure. Option C. Radial and carotid pulses. Option D. Brachial and femoral pulses. The correct answer is option A. Apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 5. A dying client is breathing irregularly. The nurse aide should: Option A. Call the nurse immediately. Option B. Continue to provide comfort care. Option C. Administer oxygen. Option D. Start CPR. The correct answer is option B. Continue to provide comfort care. Irregular breathing, Shane Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 6. The family of a dying client is upset. The nurse aide should: Option A. Ask the family to leave. Option B. Offer support and a private place to talk. Option C. Ignore the family. Option D. Tell the family everything will be fine. The correct answer is option B. Offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 7. A client is withdrawn and refuses to participate in activities. The nurse aide should: Option A. Force the client to participate. Option B. Allow the client to choose and respect their decision. Option C. Leave the client alone. Option D. Tell the client they must participate. The correct answer is option B. Allow the client to choose and respect their decision. Respecting the client's autonomy is essential. Forcing participation can increase withdrawal and anxiety. Leaving them alone may increase isolation. Offering options and allowing choice is the most therapeutic approach. Question 8. The Heimlich maneuver should be used when a client: Option A. Is coughing forcefully. Option B. Cannot speak, cough, or breathe. Option C. Has a minor cough. Option D. Is having difficulty breathing. The correct answer is option B. Cannot speak, cough, or breathe. The Heimlich is for severe airway obstruction when the client cannot speak, cough, or breathe. A client who is coughing forcefully can still breathe. Encourage coughing. Question 9. The best way to communicate with an unresponsive client is to: Option A. Avoid talking to them since they can't hear. Option B. Speak to them as if they can hear and respond. Option C. Speak loudly near their ears. Option D. Only speak to family members. The correct answer is option B. Speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 10. A client is bleeding profusely from a wound. The nurse aide should: Option A. Apply direct pressure to the wound. Option B. Apply a tourniquet. Option C. Elevate the wound. Option D. Apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 11. The nurse aide should report which finding as a possible sign of abuse. Option A. Bruises at different stages of healing. Option B. Bruises on the shins. Option C. A client who is hard of hearing. Option D. A client with memory loss. The correct answer is option A. Bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 12. When weighing a client, the nurse aide should: Option A. Weigh the client at different times each day. Option B. Weigh the client at the same time each day. Option C. Weigh the client after meals. Option D. Weigh the client before toileting. The correct answer is option B. Weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 13. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: Option A. Document the temperature. Option B. Report it to the nurse immediately. Option C. Give the client a cold bath. Option D. Retake it in 1 hour. The correct answer is option B. Report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 14. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: Option A. Leave and return later. Option B. Approach slowly and speak in a calm, soothing voice. Option C. Ask the client what is wrong. Option D. Call for assistance. The correct answer is option B. Approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 15. A client with mental health issues is refusing medication. The nurse aide should: Option A. Force the client to take the medication. Option B. Report the refusal to the nurse. Option C. Hide the medication in food. Option D. Tell the client they will get worse. The correct answer is option B. Report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 16. A client is having a seizure. The nurse aide should: Option A. Put a spoon in the client's mouth. Option B. Hold the client down to stop the seizure. Option C. Clear the area and turn the client to their side. Option D. Leave the client alone. The correct answer is option C. clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration, and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 17. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 18. The apical pulse is located at the: Option A. Wrist. Option B. Neck. Option C. Apex of the heart, 5th intercostal space, midclavicular line. Option D. Elbow. The correct answer is option C. Apex of the heart, 5th intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the 5th intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 19. When should the nurse aide count an apical pulse for a full minute? Option A. Always. Option B. Only if the client is pediatric. Option C. When the pulse is irregular. Option D. When the client is sleeping. The correct answer is option C. When the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 20. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A. Feed the client quickly. Option B. Provide verbal cues to chew and swallow. Option C. Puree all food. Option D. Remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example: chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 21. What should a nurse aide do if they experience a needle stick injury? Option A. Wash the area and report it immediately. Option B. Wait to see if symptoms develop. Option C. Apply pressure to the wound. Option D. Ignore it if no blood is visible. The correct answer is option A. Wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 22. What does the abbreviation ADL mean? Option A. Ad lib. Option B. As doctor likes. Option C. Activities of daily living. Option D. After daylight. The correct answer is option C. Activities of daily living. ADL stands for Activities of Daily Living, which include bathing, dressing, toileting, eating, and mobility. This is a fundamental concept in nurse aide practice. The other options are incorrect medical abbreviations. Question 23. A client is grieving the loss of their spouse. The nurse aide should: Option A. Tell them to move on and focus on their health. Option B. Listen and acknowledge their loss. Option C. Avoid mentioning the spouse to prevent sadness. Option D. Suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 24. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should: Option A. Document it and turn the client. Option B. Massage the area to increase circulation. Option C. Apply heat to the area. Option D. Leave it alone. The correct answer is option A. Document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 25. In the event of a fire, the nurse aide's priority is to: option A, extinguish the fire; option B, rescue clients from the immediate danger area; option C, call the fire department; option D, save the client's belongings. The correct answer is option B, rescue clients from the immediate danger area. The priority is to rescue clients in immediate danger: race, rescue, alarm, contain, extinguish. Extinguishing the fire, calling the fire department, and saving belongings are secondary to client safety.